Well, I'm Dr. Ankur Garg. I am consultant at BL Kapoor Hospital in the Department of Hepato-Biliary Surgery and Liver Transplant. So this department has been running in this hospital for almost 5 years now, and successfully tackling patients about hepatology, about liver transplant, and having a success of more than 100 liver transplants at BL Kapoor Hospital right now. And the team is dedicated with the senior most hepatologists, transplant surgeons, intensivists, and all the other specialties that are concerned with it, and having the class apart technical expertise as well as the surgical expertise in the field. Viral hepatitis hepatitis is what we mean is that injury to the liver. So that is what is hepatitis. And as far as viral hepatitis is concerned, it is transmitted with the viruses. So there are primarily 5 types of viral hepatitis: A, B, C, D, and E, out of which A and E are primarily transmitted to the food or through contaminated water. What in most of the people in childhood get jaundice is most of the times is viral hepatitis. And in less than 5% of the cases, hepatitis A or E can lead to acute liver failure or to a fulminant liver failure, leading to liver failure. Otherwise, most of the times hepatitis A and E are self-contained by the body, and one is generally recovers in 15 to 20 days. Now, when it comes to the deadlier of viruses, they are hepatitis B and C viruses. So when it comes to hepatitis B, again it is a transmittable virus. It can be transmitted with food, it can be transmitted with saliva, with blood transfusions, and it is but the good part about hepatitis B is that we have a vaccination available for hepatitis B. So I urge that everybody should be vaccinated for hepatitis B. Now it has also been incorporated in the WHO immunization protocol. So now on, all the children are vaccinated with hepatitis B. But all the elderly population, as far as India is concerned, we are still not vaccinated with hepatitis B, and I think that is one of the very important health steps that one can take, getting vaccinated for hepatitis B. And even if one gets hepatitis B, it is not that life comes to an end or it is a situation of a doom. Hepatitis B is very well controllable with medicines, and on a regular follow-up with a hepatologist or a gastroenterologist, so hepatitis B is very well curable. In around about 10 to 15% of the people suffering from hepatitis B, if not properly taken care of or if neglected, then over a long period of time, say 10 to 15 years, it can lead to liver damage, it can lead to cirrhosis, it can lead to liver failure. And as of now, around 15% of the patients undergoing liver transplant are because of hepatitis B related problems. When it comes to hepatitis C, again this is a virus which is transmitted either sexually or through blood transfusion or through contaminated needles like drug peddlers and all those people. Now this hepatitis C is a more deadlier virus than hepatitis B. It injures the liver to a much more extent as compared to hepatitis B. Again now, in recent past, over last 1.5 years, there are very effective medicines that are available for hepatitis C. Unfortunately, there is no vaccination still in the medical system which is still available for hepatitis C. So one needs to be cautious about hepatitis C, and if diagnosed, then patient can be very well treated and he can be made hepatitis C negative, but he needs to remain on a follow-up and regular medications. Around 20 to 30% of the patients with hepatitis C will land up with cirrhosis, with end-stage liver failure, and it can even land up with liver cancer. So this is primarily about hepatitis viruses. As far as hepatitis D virus is concerned, it can be transmitted only if one is suffering from hepatitis B. So D per se individually is not a concern. So A and E can be prevented with good sanitation habits and good food habits, and B and C are basically lifestyle and blood transfusion related problems. Any hepatitis, basically what we call in a common language as jaundice, that is what any hepatitis leads to. So any hepatitis will initially lead to loss of appetite, feeling of nausea, vomiting, and then with passing of time one will start feeling yellowishness of the eyes, dark colored urine. Patients can have itching in the body, and they can have some small red spots, what we call as petechial hemorrhages, all over the body. So these are the early signs of hepatitis, but these happen primarily in hepatitis A and E. As far as B and C viruses are concerned, they generally lead to a slow ongoing damage of liver, and patients generally present 15 to 20 years of time of infection when their liver is almost damaged. So hepatitis B and C can be very silent infections and they may not lead to any symptoms initially. And as far A and E are concerned, they generally give rise to a jaundice-like symptom what we see in common life. See, A and E are self-contained infections, so body takes care of themselves. So there is no medicine or no treatment available per se which can cure A or E. It will go away with time in 15 days or in 3 weeks or 4 weeks. As for B and C are concerned, they both can be controlled. Effective medications are available, and for both the B and C viruses, it is now only drugs, that is oral medications, that are available and that can be controlled. And unfortunately, if they lead to the end stage liver failure, then obviously, except for liver transplant, there is no option. To know more, please subscribe to our YouTube channel. Thank you.
BLK Super Speciality Hospital, a passion for healing.